I got involved with a local group of patients who were interested in cancer research. It's not a support group, but we were interested in contributing to research. Currently I'm on the NCRI board. I'm on the board of my local hospital trust as a non-exec director. I'm involved with the NCRI clinical consumer liaison group. But additionally, I sit on a couple of committees with Cancer Research UK. One of them is a very project-based one, which is about stratified medicine. I'm on the governance board for a project which is looking at basically the future of medicines, which will be very much individualised to the patient. But I also sit on CTAC, which is the Clinical Trials Awards Advisory Committee, which looks at all the applications made to CRUK for funding for clinical trials and makes recommendations as to which should be funded. And when I'm doing that job, one of the things that I'm really interested in is how acceptable would a trial be to patients? What would be the benefits to patients? Are patients being unnecessarily excluded? For example, does it say you've got to be under 65, and if so, why? And so on and so on. Other people around the table obviously look at the science and the medicine and so on. But it's very important, I think, that somebody who's looking at it from a patient's point of view can say this is something that we think patients ought to be able to do. I was on a hormone receptive drug, letrozole, for a few months, and after about 6 months it wasn't really working so well. And so when I saw my consultant, he said, well, you know, there's another one you can take, or there is a trial that you can enter. And I leapt at the idea because I already knew what trials were about. And it didn't take me very long to decide I would like to join in this trial. Of course, saying yes, you don't know which, it's a randomised trial. You don't know which arm you're going to be on. I could have been on arm A, which would be exemestane, which is what I would have been on anyway. Could have been on arm B, which was a drug called abiraterone, which is currently only used in prostate cancer, obviously in men. It seems a bit of a leap to try it in breast cancer with women. But I now know the science behind it, so I understand why. Or arm C, which was abiraterone and exemestane. And so I spent a day at the hospital having bloods taken and everything done. And then the computer spat out my name and I was in the experimental arm with the 2 drugs. And I've been taking them for about 5 weeks now. And all's well so far. Well, there are a number of good things about it. One is that I feel that I'm throwing every bit of ammunition at this nasty disease. Another one is that I know that this is something that may end up being a useful treatment in the future. And this is a phase 2 trial, so it's if this is useful, found to be useful at the end of this trial, then there'll be a big trial, so it'll be some years. But it would be really, really nice to know that somewhere along the line I've been one of the people who'd helped to make that a treatment for other people in the future. And to be honest, I think really if you ask people who are in clinical trials why they're doing it, that's what they'll say.